I'm Dr. Ethan Greenwell. I'm 60 years old now, and for more than 3 decades, I've been walking alongside my patients in the field of community health. At this age, I don't just speak to you as a doctor, I also speak as someone who's had my share of sleepless nights, lying awake, watching the clock tick by. And maybe you know that feeling too. Did you know your sleep and your bones are deeply connected? Most people think that lack of sleep just makes you tired, foggy, or irritable, but in reality, those restless nights silently weaken your bones like a house slowly losing its foundation. I've met countless patients over 50 who tell me the same story. Doctor, I just don't sleep well anymore. My back aches more than before, and sometimes even bending down a little gives me a sharp pain. That's not unusual, and maybe you've experienced it yourself. In this video, I want us to explore together why sleep is so critical for bone health, and what simple things you can do at home to keep your bones strong. Think of your bones as a living construction site. Every day, your body breaks down old bone cells and rebuilds new ones. When you're younger, this process is balanced. But once you cross 50, especially for women after menopause, the breakdown happens faster than the rebuild. We call this bone imbalance, and the result is bones becoming thinner, more fragile, easier to break. It's not just age, hormones play a big role. In women, the drop in estrogen after menopause makes it harder to absorb calcium. In men, testosterone levels also decline, and that contributes to bone loss. Add to that a diet low in calcium, vitamin D, and protein, or a lifestyle with too little movement, and the framework of the body starts to wear down even faster. But there's one factor people often overlook: sleep. When you don't sleep, your body produces more cortisol, the stress hormone, and cortisol eats away at bone tissue. Studies show that even just a few nights of poor sleep can disrupt bone renewal and raise your risk of osteoporosis years later. In other words, every restless night doesn't just steal your energy for tomorrow. It quietly takes away your bone health for the future. That's why, after 50, it's so important to understand this connection and take steps to protect your bones starting today. You know, there's a silent cycle that so many people over 50 fall into. And it begins with those restless nights of poor sleep. Most of us think sleep is just for rest. But to me, sleep is like a nighttime construction site for the body. When you sleep well, the workers, your hormones and your cells are busy repairing and strengthening the framework of your bones. But when your sleep is cut short, that construction site goes dark, the workers don't show up, and the house your bones slowly begins to crumble. Think about it. While you sleep, your body produces melatonin and growth hormone. They're like the lifeblood that nourishes your bones, renewing and rebuilding them cell by cell. But when you toss and turn through the night, those vital substances don't get released. Your bones don't get repaired. They simply wear down. Little by little, day after day, I've had patients ask me, "Doctor, how is it that just a few years of bad sleep made me feel so much weaker?" And the answer lies in the quiet absence of those invisible workers. And it doesn't stop there. When you're sleep deprived, you don't have the energy to move. You wake up tired, and instead of going for a walk outside, you stay in with a cup of coffee. That means less sunlight, your body's natural source of vitamin D, and without it, bones become even more brittle. Sleeplessness leads to fatigue. Fatigue leads to less movement. Less movement leads to vitamin D deficiency and weaker bones. A perfect storm, but a dangerous one. Let me share the story of Linda, a 55-year-old patient of mine. She came to me with a half smile and a simple question. "Doctor, why does my back hurt so often? Sometimes even just bending down to pick something up gives me a sharp pain." When we ran a DXA scan to measure her bone density, the results showed her bones were far more fragile than other women her age. And here's the surprising part. Linda wasn't low in calcium. She didn't smoke. She didn't drink. The biggest thing she was missing was sleep. For years, she had averaged only 4 to 5 hours a night because of stress and worry. Once she understood this, Linda started to change. She went to bed earlier, cut back on screen time at night, and swapped her evening coffee for a cup of herbal tea. Slowly, her sleep became deeper and longer, and something amazing happened. Her next DXA scan showed her bone density had stabilized. It wasn't declining anymore. She told me, "Doctor, not only has my back pain eased, I feel like I've come back to life." Linda's story makes me wonder, how many people out there, maybe even you, believe sleepless nights are just an inevitable part of aging and silently accept it? The truth is, we don't have to. Sleep isn't a luxury. It's one of the most powerful, free medicines your body will ever give you. And here's the small lesson I've taken from years of watching patients like Linda. Every hour of good sleep is like laying another brick in the foundation of your bones. You don't need to change the whole world. Just begin by listening to your body and honoring your rest. And in the next part, I'll share with you some everyday habits. Things as simple as how you eat, how you move, even how you set up your bedroom, that can help you not only sleep better, but also keep your bones strong. Because sometimes, it's the smallest changes that make the biggest difference. My friends, after talking so much about the link between sleep and bone health, I know what you're really wondering is this. So, what can I actually do at home to sleep better and keep my bones strong? I often tell my patients, the secret lies in the small habits, repeated every day. You don't need dramatic changes, just slow, steady steps, and over time, your body will respond. Let me walk you through 4 of the most important ones. 4. 1. Nutrition for bones and sleep. Have you ever thought of your meals as the bricks that build your bones? A diet rich in calcium and vitamin D is the foundation. I usually suggest simple, everyday foods, low-fat milk, a piece of grilled salmon at dinner, or even a handful of almonds as a snack. These not only nourish your bones, but also keep your heart and mind healthy. And for sleep, certain foods act like gentle companions. A warm bowl of oatmeal, a small kiwi, or a cup of chamomile tea before bed can help ease you into deeper rest. On the other hand, those seemingly harmless choices, a late cup of coffee or a glass of wine, might leave you tossing and turning. I remember a patient who said, "Doctor, I just can't give up my 7 p.m. coffee." But when she finally tried cutting it out, within 2 weeks, her sleep improved dramatically. Sometimes, we're the very ones standing in the way of our own rest. 4. 2. Gentle, safe exercise. Bones are like a bridge. To stay strong, they need to be used. Brisk walking, yoga, tai chi, all of these are gentle yet powerful, helping increase bone density while also improving sleep quality. One morning, I walked past a park and saw a group practicing tai chi. Their slow movements, steady breaths. You could almost feel the peace flowing through them. And don't underestimate resistance training with small weights or elastic bands. Just 10-15 minutes a day can make a real difference. But for older adults, safety always comes first. Wear non-slip shoes, exercise near a railing, and never push yourself too hard. I had a 62-year-old patient who was terrified of weights. We started with the lightest resistance bands, and after 3 months, his bones and muscles had grown noticeably stronger. He smiled and told me, "Doctor, I feel young again." 4. 3. A safe and calming home environment. A safe home is an invisible gift to your bones. I've seen fractures happen simply because of a loose rug or a dangling cord. How many hidden risks are there in your home right now? Just tidying up, securing rugs, and adding a warm night light can protect you from unnecessary falls. And for true rest, turn your bedroom into a little library of peace, soft lighting, fresh air. And here's a golden rule. Turn off screens at least 1 hour before bed. I know it's hard to part with the TV or phone, but think about it. How can your mind settle into calm when it's just been bombarded with news, notifications, and noise? 4. Managing stress. Finally, let's not forget the mind. Stress triggers cortisol, the enemy of bone health. But when you calm your thoughts, both your sleep and your bones begin to heal. I often teach my patients the 4-7-8 breathing exercise. Breathe in for 4 seconds, hold for 7, exhale for 8. Just a few rounds can settle the mind. Or try something simple. Write a few lines in a journal, listen to gentle music, or spend 5 to 10 minutes meditating. One of my patients once said, "Doctor, I never thought meditation could help my bones." But the truth is, when your mind is at peace, your sleep is deeper, and your bones finally have the chance to renew. So you see, caring for your bones and your sleep doesn't require grand gestures. It's in the simple meals, the quiet walks in the park, a warm and safe bedroom, and a few minutes alone with yourself. Small things, yes, but they are the foundation of a strong and lasting body. And in the next part, I'll share when you should consider seeing a doctor and the warning signs your body may already be sending you. Because sometimes, listening early can save us from a much bigger problem later on. There's a question I hear often from patients over 50. Doctor, when should I really go see a specialist about my bones? Do I need to rush to the hospital every time I feel a little back pain? I usually smile and say this: our bodies always have a way of sending signals. The real question is, are we listening? If you notice persistent back pain, or if your height has shrunk by a couple of inches, or if you've had a fracture from something as small as a light fall, those are clear warning signs. Your bones are weaker than they should be, and it's time to pay attention. But you don't have to wait until symptoms show up. There's a very helpful tool called FRACTS, developed by the World Health Organization. You simply enter some basic information: your age, weight, lifestyle habits, and it calculates your risk of a fracture over the next 10 years. I often recommend this to patients as a sort of mirror, a way to see more clearly where they stand. Still, if you want to know the exact condition of your bones, nothing replaces a DXA scan at the hospital. It's the gold standard, like taking a close-up photo that shows how strong or fragile your bones truly are. I once had a patient who, after her DXA, sighed and said, "I never imagined my bones were this weak. Thank goodness I found out early." That knowledge gave her the chance to change her habits and avoid serious problems later on. The lesson here is simple. Listening to your body early can save you from much bigger consequences. Don't wait until a fracture happens to start protecting your bones. And now, before we finish, I want to leave you with one final message. A gentle but powerful reminder of just how valuable those small daily habits are in keeping your bones strong and your life peaceful. My friends, after so many years in this work, I've realized something important. Healthy bones don't just come from medicine. They begin with the little choices you make every day. We often think health is about long prescriptions or complicated tests, but sometimes it's the simplest decision today that shapes your health tomorrow. I remember one patient asking me, "Doctor, if I could only do one thing to improve my bones and my sleep, what would it be?" I told her, "Start tonight. Turn off your screens an hour earlier. Pour yourself a warm cup of herbal tea. Take a gentle 15-minute walk before bed. That's all. Your bones and your sleep will quietly thank you." Isn't that what we all want? To stay healthy enough to enjoy our later years, to laugh with our grandchildren, to stroll under the morning sun without fear of falling or breaking a bone. So why not start today? And if you found this message helpful, I encourage you to share this video with a loved one, a friend, a family member, anyone who's also navigating life beyond 50. Because strong bones aren't just a gift for yourself, they're a priceless gift for the people you love.